Hello people, in this video let us look at a previous year question, axillary nerve asked for 5 marks. What have they asked about? Axillary nerve. So it's a nerve, where is it? In your axilla, that is below your shoulder joint, and they've asked for 5 marks. So nerve means what and all will you write? You will write its origin, you will write its course, its branches, its importance, etc. And all the muscles that these branches supply, etc. So now let's get started. Axillary nerve. Where is axillary nerve? So here you have your axillary nerve. It is in your axilla. So basically, here you have your clavicle, here you have your humerus, here you have a deltoid. Try to draw this diagram in the exam to get proper marks. Now, from where is this axillary nerve coming? Your axillary nerve is coming from the posterior cord of the brachial plexus. Brachial plexus comes from C5 to C6, C7, C8, T1, right? So that is what is brachial plexus. But for axillary nerve, the roots are C5 and C6 only. Okay, and from where does it come? Posterior cord of brachial plexus. Okay, so let's look at brachial plexus here. So here you have your brachial plexus. So this is brachial plexus, and here you have the posterior cord, and from the posterior cord here, if you see, this is the axillary nerve. Okay, now this axillary nerve is going around your humerus posteriorly. It's going around your humerus surgical neck. So that is why it is also called as circumflex nerve. Okay, so you can see here how it is going behind the, around the this is left arm they have shown, actually from behind they have shown. This is left arm from behind they have shown. So you can see how it is going behind your humerus. Okay, so it is also called as circumflex nerve. So you already got this much information. Axillary nerve is a branch of the posterior cord of the brachial plexus. Now let us look at the branches of this axillary nerve. So first of all, you have the trunk of the axillary nerve, and then it gives some branches. That is, you have the anterior branch and the posterior branch. So you have what? You have the trunk, okay, and then it goes behind around this humerus, and then it gives two branches, axillary and anterior and posterior branch. So mainly what we will focus on is the branches. Okay, so here just look at this diagram. It's much easier to understand this way. So you have the trunk, right? The trunk will supply the shoulder joint. So the trunk part of this nerve is supplying the shoulder joint. Now coming to the anterior branch and posterior branches, the anterior branch doesn't do much. It is supplying little of the deltoid, but the posterior branch is doing maximum work. You can see here the posterior division of this nerve is supplying the muscles. Which muscles? Deltoid and the teres minor, remember, and the cutaneous, that is even the skin above this muscle it is supplying, and then even the vascular, that it is supplying the artery, posterior circumflex humeral artery. Okay, it is supplying vessels also. So this is following something called as Hilton's law. So Hilton's law is obeyed by whom? By axillary nerve. Why? Because it not only supplies the muscle, it also supplies the joint and the skin around this. So that is what is Hilton's law. A nerve which supplies a muscle will also supply the joints and the skin. So that is what is Hilton's law, and axillary nerve satisfies it. So now branch is done. Now let us look at course. Okay, we are going to the course after the branches. So because we just wanted an understanding for ourselves in the brain. Course is what? Lower part of axilla, it runs downward. This nerve runs downwards, and then what it's doing, it's going around your surgical neck of humerus, is it? And basically it comes out of quadrangular space. Okay, where it is dividing into two branches. Basically here the word you have to focus on is quadrangular space. So it is goes through the, it comes in the, it is one of the content of your quadrangular space. So here's your quadrangular space. You can see that here, actually, if you're seeing here this place. Okay, so you have quadrangular space, and then you have triangular spaces, etc. But here we are focusing on this quadrangular space. The content is that you can see here, this is the axillary nerve, and then you have axillary nerves branches, axillary arteries branches, that is posterior circumflex humeral artery and vein. Okay, so these are the three things that are within this quadrangular space. Take a deep breath. I know a lot of information. This gray one here is actually the bone, that is the humerus. Okay, this one. So lateral of this quadrangular space you have humerus, medial of it you have the tricep muscle, above you have the teres minor, and below you have the teres major. Okay, so this much you will remember, right? It's because we will practice drawing all this now. So first thing we would like to draw to get marks in this exam is the axillary nerve itself, and this as axillary nerve. Okay, which is coming from the posterior cord of the brachial plexus C5 C6. You have to mention that this is the humerus, and here you can draw some clavicle here, something like this. You can draw and show a clavicle. I'm trying very hard to draw here, but yeah, this you will draw to show the axillary nerve. Okay, now let us draw the quadrangular space. So first I'll draw humerus. I'm just representing it. Okay, then I will draw the teres minor, teres major, and the long head of triceps, right? So this is teres minor, teres major, and this is the long head of triceps. What is this one in black? Humerus. And you will explain that this is the posterior view of the right shoulder joint. And you will now draw the nerve. The nerve is here now. This is the axillary nerve. And then you have to draw one blood vessel, posterior humeral circumflex artery, and you have to show a posterior circumflex humeral vein. So what is this? This is the quadrangular space. You have to draw all this to get marks in exam. Okay guys, take a deep breath. So now all the relationship and all over. Quadrangular space very important. Now let us come to the importance of this nerve. If this axillary nerve gets damaged, what and all will get damaged? Very easy to say. Because what does it supply? You know, it will deltoid will get affected, shoulder joint will get affected, and the skin will get affected. Where? On that deltoid itself. Okay, because it follows Hilton's law. So everything will get affected. So when will it get affected? Usually in shoulder dislocation, axillary nerve will get affected. If there is a fracture of the surgical neck of humerus. Correct, no? These are the two things that you have to remember. So if this nerve is affected, then what happens? The rounded contour of shoulder is lost, especially that they're talking about shoulder dislocation. The rounded contour of your shoulder is lost. Basically, the shoulder joint is affected. The deltoid is paralyzed. Okay, deltoid is paralyzed. Deltoid is a muscle. It will get paralyzed. So muscle, what was it doing? It was abducting your arm, especially from 0 to 90 degree. That will get affected. Now, who and all are responsible for abduction of your arm? Do you know? It's not just deltoid. Initially, it is by supraspinatus, and deltoid by 0 to 90 degree. Just lift your hand 90 degree. And then beyond that, you need the trapezius and serratus anterior. Okay. So now till 90 degree there is problem. After that you can lift, because serratus and what is the other one? Serratus and trapezius and serratus anterior will be fine, right? So that beyond 90 degree you can lift. That's what they will say. Okay. Then there will be a sensory loss also, because skin also is supplied by this nerve, right? So there's a sensory loss over the lower half of the deltoid, like in the badge-like area. So wherever they put badge, right, regimental badge, there will be sensory loss. So it is called as regimental badge sign. And remember, guys, Hilton's law very important. That is why even skin, everything is getting affected here. Okay, if axillary nerve gets injured. Just another point that you can write is IM injection is given to deltoid muscle. Okay.